So Douglas White here from the American Academy of Orthopedic Physical Therapy Scope of Practice Task Force. And we're doing a series of interviews with physical therapists who practice in rural environments and getting their perspective on what practice is like in rural communities. Today I have with me Genevieve Correa, who has a practice in Hawaii, and I'll let her kind of introduce herself and her practice, and we'll have a nice conversation. Genevieve?
Aloha, Doug. Thanks for having me and wanting to explore what we're doing here on Molokai. So I have my own private practice clinic on Molokai, a small island, less than 8,000 people here. We have another hospital, which is Molokai General Hospital, that's kind of partnered with Queens. So they're one of the primary physical therapy clinics. That's a considered rural health clinic. I'm actually one of the only private standalone clinics. There is one other lady, her name is Kirsten Hirsch, that also provides small services of physical therapy as well. But it's actually a blessing to be here. It's not for everybody. The rural practice clinic is definitely, how do I say this? A place where you have to focus on adapting, taking time to listen to the patients, because, how do I say this? I guess in rural communities, there's just limited resources, and a lot of the medical practitioners mostly are revolving. So we struggle with consistency of medical care. I guess that would be more of how I would define our practice. Yeah, I don't know. Sorry.
What's rewarding about practicing in
I think it's, for me, it's serving the people, to have patients and clients and just people in general that didn't always feel like they were heard or don't feel like they have access to care, to give them an opportunity to feel that they deserve the care and that they can get better. I find that when we can just take the time to educate, listen, and share perspectives, people start to feel more valued, and it puts more what's the word? It puts more value into why I went into this field of PT.
As a dedicated orthopedic physical therapist, you understand the importance of staying current with the latest techniques to better serve your patients. With gait analysis, continuing education, and technology, RunDNA is committed to accelerating your expertise so you can help runners achieve their best. Visit rundna.com/AOPT to learn more and get your free ebook, Top 5 Things Running Professionals Need to Know.
What would you say to encourage your colleagues to practice in a rural setting?
I think I always hear about a lot of people that want to do like medical missions and go to third world countries and help people that don't get the services they need. And rural communities, in a sense, are that on the turf that we actually reside and live. So whether it's a short term, contacting a clinic that you could like shadow in or volunteer your time to do, would be so helpful, because I think the practitioners that are residing and living and committing their lives to these communities could use help, even if it's for a short period of time. Because I don't know if a lot of people would really want to do it long term. I think that's a reality.
Yeah, it would give people who live there and practice there full time, a chance to, take a break, vacations, do something a little different,
Yeah.
right? Yeah.
Yeah. Yeah,
So,
I think that would be the big thing. Or, there's all these organizations that, again, set up medical missions. I wish there was something that we can honor for the rural communities of our own lands, I guess.
so what about some of the challenges, local, systemic, that you face when you're practicing in a rural environment?
I think just talking about that, like the aspect of medical missions, and I think I worked as this isn't like a bad thing because I worked as a traveler, as a locum. But you have all these organizations that help for placing, and I think it's amazing. But, from a business standpoint for a lot of these private clinics or smaller places, for some places, it's like the reimbursement isn't as good. And so to get the help we need, we're almost spreading ourselves thin just to get the help we need. And it's doesn't make it possible to maintain a private clinic at times, or it puts doubt in people to start a clinic in these types of settings. Um, so to kind of get that kind of support is important. Um, I think that would be from a local and a systemic, because, rural is not just in Hawaii, it's, across the nation. I don't know.
That's great. So you talked a little bit about how patient management is different in rural environment, and anything more you could add to that about how your your patient care is different because you're in a rural setting?
Yeah, I think having a few cases, even just this last week, of patients saying how they had new doctors and felt like they had to repeat their story multiple times, um, even for the same case that they have. And so when they're coming in to see us for physical therapy because they got a referral with us, you can see the paradigm shift a little bit, because I'm someone that's staying for a long time, that we end up taking, I don't want to say the role, because I want to say it's a partnership, right? As physical therapists, we have our scope, and physicians have their scope, and nurse practitioners have their scope, and PAs, we all, and specialists, or, we all have our own scopes of what we do. But to be like an integral part of that primary care model, to listen and advocate and, say like, oh, interesting, I don't see updated labs, or, I can see you're sharing with me that no one really went over your labs, or it looks like certain things haven't been followed up on in a few years. So I guess that's how it's a little bit different. But I think that's just because I'm here to stay. So other people that have come into rural communities that might be part of a larger system, because we're just a standalone private clinic, they have access to all of the notes and checks. And so given that I'm an entity separate, as a private practice in a rural community, the efficiency and the thoroughness that we have to provide in our clinic is different than most kind of, I guess, urban or suburban or, other communities, if that makes sense. Or I don't know if you can help Q to clarify anything.
No, no, that makes perfect sense. I certainly can relate. Being on a neighbor island and having a similar population and similar access issues, and the big primary care clinic in Waimea, which is owned by the large medical group. It's if they have a PCP that stays more than 6 months, then I'm kind of surprised, because they're just constantly rotating through, and it's very, very true. It makes continuity of care challenging for sure. Yeah.
Yeah, I know it's interesting too, because it just came to me is somebody actually walked into the clinic needing help this past week, and she fell off her bike, and she had a primary care that had left, I think like a year ago almost already, and so she hadn't had one. She was able to walk in and she wasn't sure if she had a fracture in her hip or what happened. And because she came to see and we just helped with the triage, she ended up going back to the doctor, establishing a new primary care, even though that person's going to be here temporarily, was able to get x-rays, cleared that out. Still, there was no evidence of a fracture. And then we ended up using diagnostic ultrasound and were able to see some kind of small discontinuity in like her muscle tissue, which could indicate like tear, at the tendinous junction and part of the muscle fiber. And so being able to kind of get her where she needed and educate her and get her healing in the right process when she had been enduring it for a month, so it's just in this past week to have that, like usually in the clinics that I've worked in other places, you would be like, sorry, you got to go see your doctor. Oh, sorry, you got to do this. And because of the limited care, we didn't want to deny that and at least help give information so that they knew how to communicate, because I think that's the thing. Patients feel things and they don't know how to explain them. So diagnostically, how can we help them? That would be the statement.
Save the date for the 2024 AOMPT Conference, October 23rd to the 27th in Orlando, Florida. Join OMPT professionals for 5 days of continuing education focused on OMPT, hands-on learning, research, networking, and more. Visit aaompt.org for more information.
That's great. Well, I really appreciate you taking some time to chat and talk about rural health, and hopefully it will spark some interest in people to practice in the rural health area.
Thank you.